Welcome back. If you are new here, I'm Chris, and I'm a medical doctor and PhD candidate in epidemiology. And I'm also helping the healthcare professionals to relocate to another country. And we also have our own website, globaljobforyou.info, http:/globaljobforyou.info. We post a lot of international healthcare vacancies around the world. And if you are planning to move another country, please visit to our website and start your healthcare professionals with us today. Today in this video, I'm gonna show you how to work as a specialist in Malta. Malta is a small European country, and I already made a video for the internship pathway in Malta. So most of the IMG interested to apply the internship programs in Malta, and some of the specialists asked me to make a video regarding with specialist pathway. So I made it for the requested doctor. So they have in specialist pathway, they have two different government bodies. Medical Specialist Accreditation Committee. They are responsible to assess your specialist qualifications and certificates and recommendations, issuing your certificates of completions of specialist trainings. And another one is the Medical Council of Malta. They are responsible for your registrations and licensings and practice to registrations to practice in Malta. So they have two different organizations. So they will work for you to recognize as a specialist doctors in Malta. So in this video, I'm gonna explain you a clear pathway with step by step, and a little bit focus on non-EEA countries. And some process might be the same for both EEA and non-EEA IMG doctors, but for non-EEA IMG doctors, it can be a little bit stricter than EEA doctors. So what is the step one? The step one is the medical degrees and general registrations. It's the same process with other countries like Australia or UK or US or Canada. So you must have registrations. There are registrations before practice in those countries. So this is the same process. So you need to ensure your primary medical qualifications is recognized or not in Malta. And the number two step. Malta is the European countries and their language is the Maltese. So how can we prepare for the language like English or Maltese? And Malta is one of the European country you can speak English is more common than other European countries. So it is a little bit I think flexible working environment for IMG when you start your work in Malta. But for the later years, for the full registrations or for higher positions, you need to show up Maltese language proficiency. So we will explain in later the language part. And if your medical training degree and document were not in English or Maltese, you need to show English language proficiency tags. They accept IELTS and OET. For step 3, specialist qualifications, your specialist training qualifications that could be a CCSD from Malta, certificates of completion specialist training if you complete from Malta, or a specialist training from another EU member state that is listed for automatic recognitions under the Healthcare Professional Act Part B. So they have an automatic recognition system from another EU countries. For those who are not from EU, other specialist qualifications from non-EU or EEA countries, but in this case, you will need a recognition statement from the MCMSE. They will, I already mentioned that the earlier medical specialist accreditations committee, they will assess your specialist qualifications. So if you are from non-EEA countries, your qualifications must not recognize automatically. And for the non-EEA candidates, you must have your specialist qualifications and experience are sufficient to be considered as a specialist that is equivalent to CCSD. And the step 4, applying for accreditations recognitions. So is for the candidate from non-EEA country. You must submit your documents to MCMSE for assessment. So in these, what documents you have to submit, like specialist qualifications, training logbook, or sometimes they will ask you about the specialist specialist training curriculums, or your progress report and your work experience and certificates of good standing certificates, etc., etc. So you have to pay the fees. Is often €100 for the applications process. And the step 5 is the inclusion in specialist registrar. Once MCMSE have evaluated and recommended inclusions, you can apply to be entered into the specialist registrar of the Medical Council of Malta. It means that the MCMSE accepts you as a specialist that is equivalent. They are specialists from Malta or another EU country, so they recognize you as a specialist. So you can go the registration process with the Medical Council Malta. So after getting the registrations, you can work as a registered specialist in Malta. And in the step 1, this is the additional requirements for the non-EEA countries doctors. They don't have a one-size-fits-all regulations. Also, it is very individualized, and you might need some additional requests. So it's depending on cases. Additional conditions may apply, such as proof of proficiency in Maltese or some role, and a requirement of experience. Often you are working as a full-time or as a specialist, or as certain working as a part-time. So you have to provide your working hours, or the number of years, how many years you have worked as a full-time, or how many years you have you work as a part-time, something like that. Before for some certain consultant or senior appointment positions. So these are the special or additional requirements for the non-EEA countries. And we have talked about another statutory exam for non-EEA countries doctors. The acceptance of the recognitions as a specialist from the non-EEA country is very individualized, and case by case can be varied. So some specialists, you need to take an exam like a Medical Council Malta Statutory exam. So if you are from non-EEA country, you might need to sit this kind of exam, but it depends on Medical Specialist Accreditations Committee recommendations. If you have a strong experience and your specialist training is very equivalent to the Malta, they will recognize you as a specialist. But in some cases, they might not recognize you as a specialist equivalent to their specialist. So let's talk about Medical Council Malta's statutory examinations. Recognitions of a specialist from non-EEA country can be varies, and it's depend on case by case. Some candidates can be or could be recognized as a specialist, but some couldn't recognized as a specialist. So you might need to take a medical counsel mode or statutory exam. So what is this? It's required for medical practitioners and also the dental surgeons whose primary degree is not from Malta or and another EU member states. So this exam is the professional knowledge testings and some language proficiency standard to practice safely in Malta. So what are the eligibility criteria to take this exam? So you must have a primary medical degree outside from Malta or EU. And you need to prove of your English language proficiency, and it might be IELTS academics. Overall span score must be 7.5 and not less than in each component, not less than 6.5, or OET medicines, minimum B in all 4 components. And certificate must be less than 1 year or at the submissions and may be combined from 2 sittings within 1 year. It is for English test, your certificate must be within 1 year. This exam has 2 parts. Part 1 is the knowledge, professional knowledge and clinical skills. They cover core medical disciplines like internal medicines, surgery, pediatrics, OGs, and psychiatry, and general practice and also public health. They assess your ability to diagnose, manage, and make safe clinical practice and decisions. Usually written MCQ and short answer, and plus practical or OSCE or oral exam is depend they have a different exam format in different year. So they will announce you what kind of type of questions you have to take. On this exam, so you have a concept. This exam is conducted in English or Maltese. Is purely conducted in English. So you have to prove your English proficiency text results as well beforehand. So the candidate must demonstrate ability to communicate clearly and safely with patients and colleagues in the clinical settings. So they have some rule for the registrations exam. The number of attempts, they allow you to sit only 2 attempts. And if you pass or if you fail, exam is global pass and fail. They have a very clear cutoff point, pass or fail. And its meanings are failure in one component, you will fail at all. They don't mention you. This part this part you pass, this part you fail. They will not mention. You fail in one component, everything fail. So just fail and pass is 2 outcomes. And so after passing the exam, you are allowed to apply the registrations in the medical council Malta. You will get a full or temporary registrations, and registration is the prerequisite for applying the specialist registrar. So before you are getting the full specialist registers, you might have some temporary or provisional register, something like that. So it's the practical implications. If you are IMG, you need to prepare in both clinical and language examinations. So you should prepare for knowledge and OSCE style stations, not just only English. So it is high stakes, so they allow you only 2 attempts. So early preparations, especially in Maltese healthcare contents and clinical guideline, is strongly recommended. So what is the time for the exam? According to the previous year, they hold the exam mainly on September, and sometimes some year they announce in August and April. It depends on the year, so they have only one time exam applications in 1 year. So you should prepare for 2026 if you want to work as a registered specialist in Malta, and we will provide the official website links in our descriptions below. And I would like to remind you at the end of this video, please visit our website as well to enhance your medical career with us. And I hope this video will help you if you're interested to work as a specialist in Malta. And see you in my next video.